Good to meet you, Simon. How are you doing today?
Very good. How are you doing?
Good to have you at the StartUp Health Festival.
Thank you.
Have you been before? Is this
No, very first time.
Your first time?
We only joined about 2 months ago, so we're very new to our StartUp Health Transformers.
Fantastic. Well, welcome into the StartUp Health studio. I'm excited to learn more about Elly Health. So break it down for me. What are you doing?
Awesome. So basically, what we've done is we've created an empathetic audio companion to help patients living with a chronic disease participate more in their own health.
An empathetic audio companion. Okay.
Yes.
What does that mean?
So what it means is basically, I don't know if you've seen the movie Her before, but we're very much inspired by that, providing, I guess, smart audio companionship to patients living with a chronic disease to really get them to understand their condition and, I guess, really participate more in their own health.
Okay, so say I have a chronic condition. What are you focusing on first?
So initially we're focusing on oncology. So my co-founder was a radiation oncologist. He also created the #1 cancer app in the world. So we're very much focusing on that.
Okay, so I have cancer. I'm imagining a situation that's sort of like me talking to Alexa, but Alexa's giving me better information.
Yes, I don't know if you've tried to have a conversation with Alexa, but it's kind of hard. But what we do is we one-way communication. So the patients actually listen to audio each day in the form of a daily summary, essentially.
It's a mobile app. How does it work?
So it's through a mobile app, but potentially we're looking at integrating with different smart devices out there as well, but predominantly through a mobile app.
Okay, so walk me through what kinds of audio prompts and what are they hearing?
Yeah, so they're basically, the daily summary, I guess, is made up of 3 parts. So the first part is a motivational story reference. The next part is basically a condition-specific topic. So, if a patient's newly diagnosed, it's dealing with financial stresses, talking to your family, understanding their condition, and then we leave the patient with an inspirational message.
Oh, nice. Okay. In a daily dose sort of idea?
In a daily dose. So every single day they get a new daily summary they receive at the start of the day.
Interesting.
So patients really made it part of their daily routine. We had patients looking forward to it. We had a couple in New Zealand who are in their late 70s, and every single morning they'd wake up and they'd make it part of their daily routine where they'd sit down with their coffees and listen to Elly. So people really actually, I guess, referred to Elly as a friend. It became a companion to them. So that's really the angle we tried to create, and it's something that really resonates with patients as well.
Why is, you used the word empathetic audio companion. Why is empathy so important here?
So really understanding what the patient's going through. Does that make sense? Understanding their preferences, understanding their limitations. So over time we're going to personalize, I guess, each different, bit of audio for each different patient. So it's really about us understanding what they're going through. So we have a lot of, we collaborate a lot with actual patients to really understand, what their journey is like and how we can make sure that we're not recommending things that, aren't feasible.
Yeah. So you mentioned a couple in New Zealand. It seems like it's a global product.
Yes.
How are you seeing responses? Do they differ around the world?
70% of our patients that did the trial with us were in the United States. But realistically, every single cancer patient goes through the same experiences regardless of where they are. So we kind of found in general pretty much the same.
But it's available to consumers?
Not yet. So the next phase is basically, we're really excited that we're doing a trial with the Cleveland Clinic with our pediatric oncology patients, which is fantastic. So that starts in March. And we're launching our consumer version in March as well. So these have all been trials behind the scenes before our launch.
Fantastic. So that's a big milestone.
Absolutely. We're super excited. We're only 9 months old as a company. So it's a massive milestone. So,
how did you get into this? What was your background?
So my background is actually, I co-founded multiple companies. I co-founded a company called Hot Doc in Australia.
Basically, say it again? What's
Hot Doc.
Hot Doc, okay.
Bad name, I know, but a good company.
Not bad, but I had to clarify. Hot Doc, okay.
Exactly. So basically, that company is a patient engagement platform for family physicians and patients. It has almost 5 million patients in Australia, with about 42% of family physicians using the platform. So lots of experience, I guess, creating that patient engagement. But really wanted to create a company that had a bit more, I guess, impact on patients and had stronger health outcomes, if that makes sense.
Interesting. Okay, awesome. Well, very cool. It sounds like you guys are taking off, and Cleveland Clinic partnership sounds amazing. So, Simon, awesome to get to meet you. Best of luck the rest of the day, and we'll be watching Elly Health in 2020.
Awesome, fantastic. Thank you so much.
And have a good one.